To those of you who have just joined us, good afternoon and welcome to today's webinar, Seminar in Crisis Safety for the ASD Population. My name is Claire Robinson and I am your host for today's event. It's great to have you all with us today. I have the distinct pleasure of introducing today's speaker, Mr. Scott Fowler. Scott is co-founder of Autism Outreach Network and has worked in public education for over 2 decades, serving as a teacher, lead teacher, assistant principal, and principal. Additionally, he is the parent of a child on the spectrum. He has provided training for school systems, the hospitality industry, law enforcement, and other enterprises that benefit from a better understanding from autism awareness. So without further ado, I'll turn the presentation over to you, Mr. Fowler. Scott, take it away, please.
Thank you, Clara. Good morning, everyone. And I'd like to take a moment to thank specifically OAR for extending their opportunity for our presentation for today. At this point, for those who are in attendance, we're going to take a couple of minutes to, or I'd like to take a couple of minutes and just run over a couple of quick things. But before I do, we are working on some limited connectivity here where my residence is, and should there be a issue, I will be directing Clara to move slides forward if that needs to be the case. So please bear with us as we are all certainly working from home with the current healthcare situation. Also, attendees, please once again be reminded that clinically relevant or private information regarding specific children or circumstances will not be handled during this presentation. Please direct those questions to our interface there, and they will be directed to me, and I will attend to them at a later session at a later time. With that all being said, we have a couple of pieces to share with each of you at this time, and you should see the handouts on the right-hand side of your screen. The first handout that you should see there is the COVID OAR resources, and if you're having any issues with those, please again direct them to the questioning piece. At this time, we're going to go ahead and begin the seminar, and I'd like to begin first by asking all of the attendees to take part in a poll. With that being the case, you should see a poll message coming up on your screen right now. Please take a moment now and think about what is the #1 crisis issue you believe occurs in the autism community, and we'll give you just a moment to think about that and respond. And now at this point, you should have selected one. And you see the issues that we'll be addressing today: the domestic issues, medical issues, school safety, wandering elopement, or other. We're going to go ahead and move into the poll results right now and begin the presentation. Clara, if you'd move that along for us, please.
Yes.
Many of you are seeing that domestic issues and wandering are the two highest on our poll. Actually, the highest issue, or the largest issue that we see, the #1 crisis issue in the autism community, is wandering and elopement. And with that, we're going to begin and dive right in and discuss this. Clara, next slide, please. The #1 issue that we find in the autism community, the #1 crisis issue, is elopement. And I want to take a couple of moments and share with the attendees exactly what elopement and wandering are as with regards to the actual behavior and how it is different from bolting. I also want to share that I'm not going to read every piece of information on each slide, but we're going to use that as the guide to move forward. Attendees, it's important to understand that elopement or wandering is one of the most prevalent and is the most priority crisis safety issue that we deal with in the autism community. You'll see that it differs from bolting there, and here's how. Elopement and wandering is really almost a compulsion in the spectrum disorder community, where they have a strong attraction and fascination to a specific issue. It could be trains, it could be butterflies. I'll get into detail about this, but whatever the perseveration is at this point or happens at this point, this is what is something that's very common in just about every family that I've worked with in the past, and the communities that I've worked in have dealt with this. Bolting is a little bit different. Bolting is pretty much exactly what you think it sounds like. It is running from an issue or trying to escape an issue or something that is stressful. But bolting is also unique in that the autistic individual is attempting to run from not only the stressor, but also from their reaction from it. So with regard to our topics today, both are dangerous, and we will cover both, and we're going to move right into eloping. First of all, we have a large audience with us today, and I understand that there may be some folks from law enforcement or first responders. We have practitioners and professionals, and we have parents. So I am going to try and cover as much ground as I can that will be relevant for everyone. And the first and most important thing is we move into warmer months. This is the time that we see most elopement issues occur. And it's important that we focus on the fact that eloping is not necessarily the result of poor caregiving or poor parenting. Eloping, the autistic have a really unique and uncanny ability to find the exact moment when a caregiver or a parent is slightly distracted, and then they will engage in that activity. Elopement is very prevalent during gathering holidays. So we're coming up on Mother's Day, Father's Day, Memorial Day, 4th of July. These are typically time periods where we have outdoor and family-based gatherings, and many times we see elopement occur in conjunction with these kinds of holidays. We also see elopement often occur during new transition times during outdoor settings. So some families enjoy camping or picnics, or, we have some military families that are joining us that, in the duty rotation, you'll have, home movement. With regards to, school-based kinds of activities, we'll have a lot more movement outside the backs of buildings and, within school facilities. But regardless, the number one takeaway here is that we need to be aware that eloping is the number one crisis issue. And, it is the biggest danger because we look at the age levels of individuals who are on the spectrum and the issues that they encounter. Now, before I move into the specifics, I do want to touch on a couple of items at the bottom of the screen there, where you see missing autistic children do not fit the Amber Alert criteria. For parents and also first responders or law enforcement, This has been a frustration in the community for quite a long time. The reason why they don't fit that criteria is because you need to have confirmation of abduction. So our law enforcement personnel and our first responders will understand that. Also, parents, the reason why the autistic are not added to the Amber Alert criteria for being missing, above and beyond the abduction piece, is a number of other developmental disabilities experience similar kinds of concerns and going missing. And I think that our lawmakers at this point are trying to keep that kind of designation and criteria separate from the disabilities community. I'm not going to get into too much detail about that. There's a lot of controversy in the community, but I just want to touch on that point, that it is a piece that we do look at. Claire, if we could have the next slide, please. Now, to get into the specifics, you'll see some very relevant data there and the sources that are quoted at the bottom. But I do want to flag a few pieces for everyone involved. Number one, 23% of autistic individuals who elope were in the care of someone other than a parent. Roughly half, almost 48% of those children, attempted to elope from an environment that was a safe environment, and this is a rate that's 4 times higher than their unaffected siblings. And then you can see for 2009, 10, and 11, and this is a trend that's unfortunately continued, with elopement in the autism community, accidental drowning occurs and is accounted for 91% of the fatalities that occur in our community. 68% pass in a fresh or naturally occurring body of water. So when we talk about elopement and wandering, it occurs frequently. Many parents report that they have had an issue or a close call with it. And, you know, we can see the data there. And that data has continued to the present day. This is why it is so dangerous. More than a third of the children who do elope usually have communication issues or may have communication issues, and they may not be able, they may be nonverbal, may not be able to communicate their name, address, or phone number. You see there 2 and 3 parents of elopers report that they've had a close call, and 32% of those close calls were within a potential drowning situation. This is, as you can imagine, an extraordinarily stressful behavior. And now we look down towards the bottom of the slide. Children with autism are a little over 8 times more likely to elope between the ages of 7 and 10 than their neurotypical peers or siblings. Please keep something in mind when we talk about this. Elopement is not contained to just children between, obviously, 7 and 10 years old. It can occur earlier or later. And unfortunately, in the United States, we have a great number of cases that have occurred either before or after those age groups. But when we talk about statistically what we're looking at predominantly that group there. With that being the case, I want you to take a look at right below that age group where it says half of families of elopers report that they have received advice or guidance about elopement from they haven't received any advice from a professional. And that's really germane to our discussion today. The reality here that we're looking at is that we have a number of professionals that are now aware of and working with the autistic in our communities, but they may not themselves be aware of the kinds of issues that we're looking at within our community. Parents are reporting that only about 19% of parents are reporting that they've received this kind of support from a psychologist or mental health professional, and only 14% have received guidance from their pediatrician or another physician. And folks, frankly, I work quite a bit within the medical community and the mental health community with regard to consulting and working with families, and they themselves, and what I've seen here regionally in Mid-Atlantic, but also to know it's a much larger issue. You know, professionals are not maybe necessarily aware of these pieces. So, you know, as a community, this becomes something that we all need to be aware of, and we need to certainly share so that we are all on the same page. Claire, if you could share the next slide, please. Now, when we talk about elopement and wandering, parents and schools and providers have different focal points when we are aware of elopement, wandering, and what we would do to this. I want to share, not only as a parent, but as an advocate and as an education professional, none of these pieces in and of themselves singularly work necessarily more or better than others. What I'd like for the community and the attendees to understand is that typically the best practices that we are seeing and from the data that we've collected are that a combination of the following pieces are shared and used in conjunction as needed. Certainly parents install locks and door chimes on the tops of doors and windows. And for those of us who are parents and have had toddlers, we've had baby gates, you know, you are aware of potential dangers within your home, but that continues within the autism community. And parents, if you've not already done so, if you're a parent of an autistic child or you're newly diagnosed, you know, these are pieces that you need to be aware of. And please be aware that autistic individuals are extraordinarily adept at defeating a lot of these measures. So not only having them in place, and having them installed and activated, but also, you know, as parents and as caregivers, we need to, you know, actively be aware of the fact that there may be an elopement issue that could occur at any time. Many school-age children have identification in terms of cards or shoe ties or backpack clips. And those are important pieces because they may elope from school or from a school-based activity where they have those items. We also want to make sure that when we are dealing with, you know, attempting to mitigate these kinds of issues, that we educate our neighbors, we inform law enforcement, EMS, and then you see the ABA piece. I personally, as a parent and as a professional, when we first became aware of elopement issues with my son, I began doing what most parents do, researching things, reading on the internet, learning about this, and like many parents, was just out and out terrified about what could happen and what the potential is. For those of you who may not have a child on the spectrum or may not have a close touch on this, let me share with you just what elopement looked like for me and can potentially look like for a lot of parents, and in a true circumstance about how quickly it occurs. Like many parents, you know, you spend lots of time reading with your children, and a very common toddler age book is The Very Hungry Caterpillar by Carle. And if you're familiar with that book, it's about the life cycle of a caterpillar turning into a butterfly. And my son, when he was 4, was very, very much interested in the life cycle of butterflies and caterpillars. And at this point in his life, it was his perseveration. And in a very quick succession of events, I was outside with my son. I was taking care of some maintenance on the car, and was keeping an eye on him and was very aware of elopement activities when his younger brother was sent out to me, who was 2 at the time, and I detracted my attention for just a moment when my then 4-year-old took off across the backyard. Now, he was completely oblivious of a very large body of water close by. He was completely oblivious of the neighbor who had a very large couple of dogs. He was focused on a butterfly and was following it and was in immediate danger. And it literally happened just quite that fast. So parents and professionals, please be aware that, you know, it's, again, like I said, it's not a parenting piece. It's not a neglect kind of issue. You know, when we deal with elopement or lost autistic individuals, and we'll deal with this here a little bit more in the presentation, you know, when law enforcement has to be involved, there are some pieces that we all need to be aware of, and that's why we're having this discussion today. I have made it a practice as a parent to educate the neighbors in my community, but I go a step forward. You see law enforcement and EMS, where every year I bring updated information to our law enforcement and our fire rescue EMS, and that information includes, you know, height, weight, hair color, you know, those kinds of pieces, and, you know, relevant medical details. And I always make sure that when I'm in the community, and this is something that if you're not doing this as a parent or as a professional, if you're working with families, you might want to remind them of this. You know, take the opportunity to, as a parent, make sure that you introduce yourself frequently to fire rescue EMS folks, because I will tell you that the average autistic individual, particularly within this age group range, will see a police officer or they will see a fireman. And for those folks who may be involved here today, they will recognize that, you know, you're a police officer or you're a fireman, but they won't recognize your duty or your responsibility. And so this becomes a situation where parents, you really want to make sure that not only are you letting your neighbors know, but you're taking frequent opportunities to introduce and reintroduce your child. You know, we would hope that we would not ever have to attend to these kinds of situations, but I can tell you as a parent, it's happened to me several times. And by taking these advanced steps and being proactive, you are ensuring the safety of your child. I also go a few steps further when we go to the supermarket or the deli or the church. You know, there's a great number of folks that recognize, you know, both of my children in the community I live in, but they are aware that my oldest son is autistic. And it's more about, for me as a parent and as a professional, providing a blanket of a number of people in a community that recognize that you know, if they see my son alone, there might be an issue, and he's got some comfort and familiarity, not only with who these folks are, but that they know and are aware of the fact that he is autistic and that presents some issues. Clara, next slide, please. Now, I am sharing the following slides so that as a community, we all have some understanding. I do specific law enforcement training, and you're going to see some pieces here. And I want everybody to be aware of it. When an autistic person becomes missing or goes missing and the frantic parents are contacting, you know, 911, the first thing that I am teaching and sharing with law enforcement is to find out what the length of time is that that individual may have been missing. And you see the piece that I'm sharing with them. When I do these presentations, if a law enforcement finds that the autistic individual has been missing for 30 minutes or less, the search parameter becomes 1 mile. And typically when I do these presentations, there are gasps and there is silence, because for those who are involved in search and rescue, searching a 1 mile square grid is extraordinarily difficult, and it requires a lot of manpower and a lot of resources. That always catches their attention, as does the next piece where you search water first, because as we saw in the previous slides, when an autistic individual elopes or goes missing, they often end up in a lot of trouble or passing away in a body of water. Now, there are a couple of reasons for this. It's no secret that children like to go swimming and enjoy being in the water. And, as I said previously, we're moving into, warmer months, and those are fun activities to do with children. But there are two specific reasons that the attendees may not be aware of that are really target issues, red flag issues for those of us in the community. First of all, if you've ever been in the swimming pool and you submerge your left arm and then you take your right arm and do a fluttering motion close to your arm, you will feel obviously the fluttering of the water on your arm. I'd like for you to relatively think about that in regards to occurring on top of your entire person. And that is very similar to the kind of very pleasing feedback an autistic person will receive oftentimes in the water. They don't fear water necessarily. They look at it as soothing, as comforting. And so in their minds, water is not a place to be fearful. Unfortunately, they may or may not be adept at swimming. And obviously when they elope, they're not looking at water as being a danger. And unfortunately, it occurs pretty quickly. The second piece here is something that I mentioned earlier. A great number of the autistic in our communities may be only partially verbal or nonverbal altogether. But when you're dealing with water issues, if you talk to any first responder or lifeguard or anybody involved in water safety, oftentimes we sometimes think that somebody who's in trouble in the water will be able to shout, "Help, help, I need help." And that is often not at all the case. That is why drowning is so dangerous, and it is why lifeguards are on duty and so actively engaged and making sure that everyone's safe. But in the autism community, if you've got somebody who is unable to articulate or call for help, that's the double-edged sword that we're dealing with here. So, when we go to a missing piece, I'm always telling law enforcement, is it 30 minutes or less? Find out if the individual is verbal or nonverbal, and then to figure out if there are any local perseverations. So trains are often very interesting for the autistic. As I mentioned, my son had a perseveration for a long time over butterflies. So those are the pieces that we all need to know about. It's also important that if the family has been recently to a local park or there is something within the locale that they've recently gone to. For a long time, my son just loved to swing, would swing for hours and hours and hours if I let him. One of the issues that we felt or that I had to deal with as a parent was not once but twice he took off for a local park. So these are things for us to be aware of when an autistic individual goes missing or elopes. And then I'd like you to look at the next graphic. The autism community, an autistic individual is 7 times more likely to interact with law enforcement than the general population. And, when we're talking about elopement, obviously, that's the big piece that we've been talking about here. The second piece, when we were doing our poll earlier on, is when an autistic individual is a victim. And we will talk a lot about bullying in school situations, but being unable to articulate or unable to clearly articulate issues makes the autistic very large targets for a number of on-person crimes. The third area that is an issue within the law enforcement community and the autism community that we're addressing now is either dangerous or aggressive behavior. And we look at domestic situations that occur as, autistic individuals grow and age, and as their caregivers age, there are lots of times that we will find that the autistic will have outbursts or have difficult times because of stressors and will act out either on a caregiver or a situation or with an individual. And that is an area that is of particular interest to law enforcement, because when they are called to a domestic situation, that's one of the most dangerous things that law enforcement can do. And, by having your child registered with law enforcement, by making them aware, by always making contact, in conjunction with law enforcement taking a much more active interest in working and supporting the autism community, you're building a bridge for awareness so that we can recognize best outcomes. SROs stands for School Resource Officers and school staff. And the next piece that I really want to start talking about is restraints and seclusion. So we've touched on some things that are difficult and are challenging in the autism community. Obviously, school-based activities and the things that go on in schools are going to have an impact. And certainly parents and professionals need to be aware of what occurs and what is going on within public school systems with regard to restraints and seclusion. First, I will say that in regards to seclusion, this should not be occurring. And it may have occurred with some notoriety in the past, but now there is enough of training and understanding and awareness that really seclusion is really very rare that I have found within school systems, but the much larger issue becomes restraints and when that's appropriate. Folks, as a former principal of a special needs school, I will share with you that I was responsible for making sure that appropriate staff members were trained in the appropriate use of restraints when necessary. But as an administrator and as a previous teacher, the idea behind restraints was to not have to use them unless you absolutely had to. And the idea was to get ahead of outbursts or meltdowns before they occurred and mitigate that. But on occasion, it may become necessary for various reasons. Within educational communities, particularly, restraints are usually done by a team with only one member of that team talking and soothing that individual. So before we can get deeply into what a restraint looks like and when it's appropriate and when it isn't, I'd like the attendees to kind of visualize a bell curve. And on the left-hand side of the bell curve would be where a flashpoint begins, a stressor begins, an environmental piece that it begins causing the process for a meltdown to occur. And as you go up the bell curve, obviously you get to the top of it. That's the point where the meltdown has occurred, and then coming down the right-hand side of the bell curve and the calming down piece. Within school systems, we don't ever want to have a student ever get to the top of that bell curve and have a meltdown. That means that we have missed pieces. And so with regard to restraints, parents and professionals should all be on the same page with regard to an active interest and not allowing that to occur. I will tell you that the last person that ever wants to have a meltdown is that autistic individual. And this is where it is really important for parents and caregivers to be engaged with the school principal and the teachers and the school staff. If your child is prone to migraines, if they have olfactory issues where certain smells are triggers for them, you need to share that information, and you need to work together to actively work with students and with staff so that you are not looking at a situation where a meltdown is triggered or occurs. Now, to that end, to the parents that may be joining us, not every school professional sees it the same way. The best way that we can mitigate these kinds of situations are having webinars and discussions just like we're having right now. But it is important for parents to understand that if it is necessary for school staff to involve themselves in a restraint situation, the only time that that's acceptable or allowable is when the student becomes a danger to themselves or to others. And there are very prescribed programs and training pieces that school staff have to go through. As a parent of an autistic child, it is your responsibility to understand exactly what occurs. And so you definitely want to make sure that you're talking with school staff to understand exactly what occurs and how it occurs and when and who will be involved. Obviously, we do not want to see restraint situations, and we should never see a seclusion situation. With regard to restraints, every effort should be made between parents and caregivers and school personnel with regard to avoiding restraints. And to our first responders, fire, EMS, law enforcement, we have a unique issue that occurs within the autism community, and it's a two-part piece. Oftentimes, the autistic are and can be what we refer to medically as low-tone children or low-tone babies, which means while in utero, their upper quadrants of their chest and neck and back are less developed than their typical peers. And that can lead to some medical issues with regards to law enforcement involved in restraints or, those kinds of pieces. They are also often asthmatic. And so we really don't want to get involved in these kinds of situations if we can avoid them. Now, I often say to law enforcement specifically, they are trained to obviously apprehend individuals or attend to individuals who are maybe acting out. But within the autism community, the first thing that I teach them, and within the developmental disabilities community at large, if it becomes necessary that to ensure safety, law enforcement, obviously I would say, you follow your training, but as quickly as possible, you want to make sure you get your individual, if you know that they have an autism situation, on their sides. Unfortunately, we've had lots of situations where individuals were harmed or worse because of either poor restraints within the school setting or within a law enforcement setting, and everyone not being aware just how dangerous this really is. Within school settings, appropriate training is set up, and this is where parents really need to be involved. But you need to have an understanding that there are some medical issues that go on that are pretty commonplace within the autism community. Next couple of pieces we see here are also issues where the autistic run into problems. And we see here community, teens, medical malls, sports, etc. Many teenagers have cell phones at this time right now, and our HFAs and our ASD kinds of individuals are all looking to do just what their peers do. And with regard to that, they may practice some social media pieces that are not acceptable. And a good example of what to look out for and what to be aware of would be an autistic individual who, is socially reaching out to others. And with regard to that, they want to be accepted just like everybody else, but, they might be calling somebody or responding to somebody at inopportune times. And so parents, you have to set some clear parameters, but, to our community at large, when we're dealing with social opportunities, often the autistic have great difficulty with them. So we need to assist them with what is acceptable, and we need to define that clearly for them. And that leads to the last area. Rarely do the autistic engage in intentionally committing an offense. In the autism community, they are rule followers. We like to follow procedure. We like to follow routines. They often will get themselves in trouble because they have had a social misread. And, we could spend quite a bit of time here. I want to make sure that I leave us enough time for some question and answers. But let's be aware of the fact that when those occur as a community, oftentimes, especially law enforcement personnel who may be involved here, it is a total social misread. It is a total misunderstanding. And I won't get into great detail about some characteristic kinds of behaviors above and beyond, maybe partially verbal, nonverbal, not making eye contact. A lot of those pieces that I involved in the autism trainings for law enforcement and fire responders, EMS, have to do with specifics that they would look at. But as a community, we should be aware of the fact that we should announce that an individual is autistic, or that we can make inroads in towards, individuals who are on the spectrum, assisting them in what are appropriate social modalities. Next slide, please, Clara. You see some pieces here that I'm not going to go into great detail about. There's some pieces that participants can click on and be shared with. But again, make your child known to law enforcement, fill out appropriate forms and update them. And then as appropriate ID cards, you see a piece there, emergency contact form that's available from the American Academy of Pediatrics. Parents, it's really important to update and stay on top of this and make your child known frequently. It is a great help to everybody in the first responder community when they are very well aware of your child and have frequent interaction. When you do that, we have an understanding of an individual, and that's a great help to them. Next slide, please, Claire. As you see here, same kinds of pieces, but for parents and especially for first responders, just like law enforcement, you want to make your child known, but something of note. Oftentimes, we'll have something like the Wong-Baker Faces Pain Scale, and you may be familiar with this, where you have a smiley face on one side that shows no pain, and then a very distraught, upset face on the other end of the scale. For those folks who work in our medical community with the autistic, this rarely works well because of their social misreads. They don't understand it. And a lot of times, when we're looking at, automobile accidents with entrapment, sports kinds of injuries, falls, those kinds of things, we're going to say, well, what is your pain? How do you feel? To those folks who are providing care in that situation, and to parents to just be globally aware of, this does not work well at all within the autism community. And it's because they often read faces very, very wrong. A good example that I can share is when my oldest son was younger. He accidentally had his hand closed in a storm door by, unfortunately, his little brother. And we got him out of the door, and we went to the emergency room, and they want to do X-rays. And the first thing that the attending physician said was, he brought out this Wong-Baker pain index, and he said, well, how does your hand feel? Does it feel really bad? And, the hand was swelling, and it was obviously causing my son pain. And my son went right to that total social misread. That was a learning opportunity for me as a parent, but also that ER physician. So that's something for us to be aware of. Also, to any of our medical personnel and to parents globally, We have tactile sensory issues that occur frequently within this community. The best case scenario is to demonstrate a care piece before actually integrating that care piece or engaging that care piece with an autistic person. The next piece there is to remind any kind of ambulance crews or transportation crews in a situation that when you have an autistic individual, please call ahead to the ER ahead of time. If you know you have an autistic individual, or you may suspect that, by calling ahead, the last place you want an autistic individual to be is in the middle of an emergency room close to the nurse's station, where the doors to the ER and the ambulance group are coming in. We have light and sound sensitivity issues. We have all kind of tactile and olfactory issues. And the best thing to do, if possible, is to try and mitigate some of those issues by calling ahead, making medical staff and ER aware of the situation, and also taking some time and some sensitivity to, place an autistic individual in a care room or care bay farther away from noises and sounds. Also, please, parents, make sure that if you've not done so, that you register with medical alert, particularly if your child is asthmatic. As an autistic individual, you want to register them, but you want to also register any other medical issues so that those are always aware to the treatment staff. Next, excuse me, next slide, Clara. School safety, we're at the time of year where there's a lot of transition, and obviously in the current COVID-19 situation that we're dealing with right now, we're taking a look at, all the school safety issues. The biggest thing that I can share right now is making sure that your principal, your child's teachers are very aware of what your child's needs are, what their stressors are, what their sensitivities may be. And, when we talk about crisis situations, please make sure that your school principal and your school staff know that if your child goes missing for any reason, they are to contact law enforcement immediately, and make sure that you get that in writing. Make sure that's very, very clear. Oftentimes, school administrators deal with a multitude of issues, and they are reticent at times to contact for a variety of reasons. In a situation like this, and as I detailed throughout the presentation, you don't want to take any chances with your child, but you need them to understand. And you need to understand as parents, they're responsible for 500 to 1,000 children in a building, all with different kinds of situations. You need to make sure that they are very clear about what your expectations are should a situation occur. Also, please, parents, this isn't a time when you're dealing with school situations in schools to hold back information. You need to make sure that you are honest and straightforward, and you need to do your utmost best to work with school staff so that they understand seclusion, restraint, your child's sensitivities, your child's issues. We all want to be on the same page. And the best place to be is when we all have an understanding of what is occurring with your child specifically. Clara, next slide, please. All right, bullying and ASD. We have a little less than 10 minutes, so I want to make sure I have some time for some questions, but you can see some pieces there. Educators, you need to be aware that the autistic are very much the target of bullying. And because when they are under stress, particularly when they're in a general education kind of setting, they may become nonverbal. Educators, teachers, you see the stats there. You need to be actively looking at children who are autistic, and you need to be actively looking at situations where you turn your back or there's a hallway where they may be bullied. A lot of times, they are unable to articulate this. You will find, and I found this with my son, that the best way for us to all be on the same page and talking about things is for me as a parent to explain what are stressors and what are issues we faced in the past, but also to advocate for my child. But, teachers, the best thing you can do is to make sure that you've got the visual routines and picture schedules that are in place. Obviously, we want to take a look at matching children and their strengths and their abilities to socially engage with others. And they're going to need some direction, and they need to have some active monitoring involved. So teachers and school staff, you can't leave the autistic to themselves when it comes to this. You need to be very actively involved and set schedules and actively monitor their pieces. Clara, next slide, please. At this time, you see some resources, and I wanted to afford just a few minutes to attend to some questions. I know that Kim received a seed question earlier regarding, some pediatric practices and some things that are, possibly occurring with regard to stressors and some issues that they're facing. To professionals, I would say, be aware of the difference between routines and schedules. In the autism community, we maintain routines, where in a professional clinical setting, you're going to maintain a schedule because it's necessary. That's probably the first thing, and to have some flexibility within your scheduling pieces. Kim will reach out to the folks that shared that question, and I can provide some specifics. But at this time now, if there are some other questions, I will be happy to entertain them.
Great. Thank you so much, Scott. So that concludes the presentation portion, and we'll begin the Q&A session of today's webinar. As a reminder, you can still submit questions through the questions pane in your control panel. And our first question is from Robert, and that question is, how can you explain crisis to an ASD student with the least amount of words?
Typically, Robert, what you're going to do is, when we look at social stories or picture schedules, we know the autistic are visually inclined. And if you have a specific situation that is something that you need to address, 2 or 3 pictures for them to be aware of something. That can be as simple as taking your phone outside and taking pictures of things that are dangerous or what occurs, or copying and pasting items from the internet. But what you want to do is really, using few words, use pictures, and then to practice what that would be and why that would be a problem. Next question, please.
Great, thank you. And the next question is, do you have advice on how to address challenging behavior in a pediatric setting? For example, when a patient becomes unruly in the waiting room, aggressive behavior during an evaluation session, or refusing to leave at the end of the session?
Well, absolutely. And this alludes to something I shared earlier. When we're in a clinical setting, whether it's a pediatric practice, OT, PT, SLT, whatever it might be, we need to understand that parents are engaging in routines, and just getting to your office can be very difficult. And then you have to be on the same page with your patient with regards to issues. So a prime example, dental appointments are very difficult in the autism community. My son had very significant issues in the upper right-hand quadrant of the oral cavity. He is now 12. He just had his first complete cleaning 2 months ago, and it was a major victory for us, with the dentist. Up to that point, there were plenty of times that we had to be very flexible. There were plenty of times where there would be issues that occur. So to clinicians, I would say continue to reach out to parents and get on the same page with issues and challenges that they're facing, but understand that their routines may not match your clinical schedule. And something I want to bring up that happens very frequently, and for all of our clinicians, this is something you may not be aware of. low pressure systems cause grievous concerns within the autism community, and we can have spikes at any time. And that could be prior to us getting in the car and going to a doctor's office. It could be while we're in the car. It could be while we're in the practice. Now, obviously, because of time constraints, I want to try and get to a few more questions, but Kim will forward me that information and we can work on a little bit more. But the biggest thing is understanding the difference between routines and schedules and working with families. Claire, are there any other questions?
We have another question here from Lee, and the question is elopement a behavior that can have sudden onset without a history of that previously?
Absolutely, Lee. You know, parents sometimes maybe miss something. And, you know, my own son, and Lee is an example, moved through several things that were perseverations. You know, there were weather patterns. He was into clouds. He was into the very hungry butterfly. And, you know, sometimes, you know, recently now he's into middle school. We went through Harry Potter, where we had to watch every movie. Everything was Harry Potter all the time. And now we switched back to Star Wars. You know, to kind of answer your question globally, Lee, this can happen very quickly and without really any preparation. So, you know, it's like everything in the autism community. We need to be flexible, but we need to be aware. Clara, any more for us to attend to?
That is actually all the questions that we have time for today. So thank you, Scott, and thank you everyone for joining us today. Once we close out the event, you will receive an exit survey, and we would appreciate it if you would complete that and provide your feedback. Everyone will receive a follow-up email with a link to today's video recording and materials within the week. On behalf of the Organization for Autism Research, thank you for joining us today and have a great rest of your day.